It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Let's get today's show started with Interventional Cardiologist, Dr. Annie Varughese.
Doctors on the military post couldn't tell me exactly what it was. So I was being treated for pneumonia. Then eventually I moved here to Houston. And that's when I met Dr. Varughese, and she diagnosed it as enlarged heart.
Stephen Jones, wonderful man, developed cardiomyopathy, a weakness of the heart. And cardiomyopathies can occur because of coronary artery disease, blockage of the vessels that feed the heart. Can happen from viral illness that can attack the heart. And many other metabolic derangements can cause problems with the heart, the pumping of the heart. What he had was a problem with the muscle, and we were able to change that by sending him to Texas Heart Institute at the appropriate time in order to get a device that could help the pumping mechanism of the heart.
Last year, I had a heart pump put in, and I've been living off of that right now for the last year and a half.
Left ventricular assist device, and they come in different types, as we've talked about with several doctors at Texas Heart Institute, including Dr. Frazier and Dr. Delgado that we've shown on the show before. But here's a real live patient that we had from our practice, that was able to benefit from that technology.
I thank Annie Varughese a lot. She's been truthful, she's been up front. She let me know, even though she told me some things that I didn't want to hear, but and by her acting aggressively on this, it has saved me. And I would say I devote a lot to her.
Well, it used to be a bridge to transplant, that it was only a small amount of time that they had to wait, but now they can use that as their heart, basically, for a long time. And it's just because they've gotten smaller and better and safer.
Get at least 7 hours of sleep a night. It will help you live longer, lower your stress, sharpen your memory, and reduce cravings for fattening foods.
Tiku broke his jaw growing up and his teeth never lined up until he met oral surgeon Dr. Paul Metz. To find out more about Tiku's story and other life-changing stories, log on to bestdocsnetwork.com.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that I honestly, in my practice, I probably see 10 to 15 times a day. So typically someone complains about that first step in the morning when they get down. When you bear weight, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle. And it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
Patients often ask me how long they are contagious. Obviously, they don't want to expose other people to what they have. Well, for most diseases like the flu, bad colds, things with fever, you're contagious until the fever is gone for 12 to 24 hours. I usually tell people you can go back to school or be around people without putting them at risk once you haven't had fever the night before. So if you don't have a fever after 6 p.m. at night, then the next day you can be around people. Now, the problem is you're probably contagious before you get the fever with many illnesses, maybe 10 to 12, maybe up to 24 hours. In chickenpox, you may be a couple of days before the chickenpox breaks out or gives you a fever that you're contagious. But for most diseases, it's that 12 to 24-hour routine, so that's when you want to stay away from people. Now, there are other things like hepatitis. Those can be contagious for a long time, a couple of weeks before you even know you have it, and even for months and years afterwards. So ask your doctor about those particular diseases, but on the others, just use that rule of thumb, 12 to 24 hours.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
Did you know that on our website, bestdocsnetwork.com, you can request an appointment with any of the great doctors you've seen on our show today? And that includes our next doctor, head and neck surgeon, Dr. C.T. Nguyen.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swollen part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe and now I can. We just appreciate what Dr. Nguyen has done for my life.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing that's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage and that they were decayed. And he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth. And George is a very outgoing person and likes to smile and has a great smile. And so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, Many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
On our website, bestdocsnetwork.com, we have an interactive map that can help you find a doctor closest to you. And that could be our next doctor, plastic surgeon, Dr. David Altamira.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, you know, you can always do more, but let's do something modest for now, and just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Laughing not only eases stress, promotes social bonding, and lowers blood pressure, it may also boost your immune system. So bring some humor into your life.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radiofrequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much. Even though they say, oh, it's not going to hurt, it's not going to hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
For more information and to check out hundreds of videos, head to our website, bestdocsnetwork.com. And for those of you exploring your weight loss options, stay tuned for our next doctor, Bariatric Surgeon, Dr. Robert Marvin.
I kind of came to a realization that I obviously was not healthy, and it got to the point where it was kind of borderline embarrassing going shopping, and I would shop for clothes and I would cry in the dressing rooms, and I realized at that point it wasn't 5 pounds that I had put on, it wasn't 10 pounds, it was, I had gained about 100 pounds without really even, I can't say I didn't know it, but I think I was kind of in a state of, well, denial.
Stephanie's lost all of her extra weight, so that's ideal. That's not, we don't expect that, we hope for that, and she's achieved that. She's achieved it because the surgery's given her a lot more control, but she's exercised that control.
I got the surgery March 5th of 2012, and currently I've lost about 115 pounds.
She's really changed how she eats and limited it to very healthy things, natural things, local organic things, all of which have pretty much a low glycemic index. She's cut out almost all the animal fat out of her diet, and then that's ideal.
Everything has changed. Just a different joy. My kids are proud of me, and at work, working is easier. I realized that it was absolutely the best thing that I ever did, not only for my life right at this moment, but for my life forever.
Her whole approach to eating has changed, and she's involved her family and friends and coworkers in that. And that will produce an effect known as the halo effect, which is that patient having the weight loss surgery can actually transmit better lifestyle to some of the people around them, and those people actually benefit from that.
And so everything has changed. How I saw myself, how I see myself, how I see food, how I cook, how I shop, everything. Totally, like, I feel like a totally different person.
Janice was experiencing a lot of problems with her sinuses until she met Dr. C.T. Nguyen. To hear more about Janice's story and hear other life-changing stories, log on to bestdocsnetwork.com.
Even in 2013, stress incontinence and urinary incontinence in general is a very big concern for a lot of women. Often starts with childbearing, progresses as women get older, and by late 40s, early 50s, a woman may be noticing She's leaking urine when she coughs or sneezes, when she jumps, when she exercises, or for a lot of women the problem is that she can't sleep at night because she has to wake up and urinate frequently. If you have stress incontinence, a very simple outpatient procedure will allow you the ability to exercise without losing urine and may free you from pads and diapers that you may be wearing. But just have to talk about it. In certain other types of incontinence may require just medications to fill.
And Dr. Imtiaz can also treat her patients with a simple and common outpatient procedure.
So for urinary stress incontinence,
Dr. Imtiaz and these procedures, patients no longer have to live with this very correctable problem.
Now the interesting thing is that even in today's day and age, women aren't talking about it, and it's a very common problem. And the funny thing is it's a fixable problem, very easy fix.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was at Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner, and so he's seeing people in the clinic, and so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile, and then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
That's going to wrap up today's episode of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. For more information, head to our website, bestdocsnetwork.com. And if you have questions or comments, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. I'll see you next week.